Hi, Ebony. Can you hear me?
Hi, Cassandra. Is that you?
Yes, it is.
I hear you loud and clear.
Great. Okay, just want to make sure. Let's see if you can see me clear too. I'm gonna click this here.
So I already have everything set up on YouTube. So it's running off of your guys' YouTube page. I changed our link to match that.
Okay, wonderful. I guess nobody's on other than Counselor Romero, I saw.
I'm actually going to start letting Harold and Dave are on now. So I'm going to start letting panelists in here in a few seconds.
Very good. Thank you. I'm going to mute myself.
Sounds good. Dave, can you test your mic?
Can you hear me?
I can.
All right. Ebony, can you hear me?
Hi, boss man. Yes,
Ebony, can you hear me?
yes, I can.
Okay.
Hi, Max.
Hello, Janice.
You were the brave one to turn your camera on first, your video.
Can't be any worse than the last time, Janice.
I haven't gotten any better looking since the last meeting. I'm sorry.
Yeah, same here, so.
Hi, Counselor.
Good afternoon, good afternoon, good afternoon.
Good afternoon, Dave.
How's it going, everybody?
Good
Hello.
afternoon.
Hello.
How are you, Councilman Romero?
I'm doing good. And you, Commissioner?
Good, thank you.
Hello, everyone.
Good morning.
Good evening, everybody, counselors, commissioners.
Good evening.
Hello,
Andrew, how are you?
good evening.
How you doing, Counselor?
Good evening, Councilor Vidal. Harold. Mr. Trujillo, how are you?
Good afternoon, Krishna.
Luis,
Hapchik.
¿cómo está?
Good afternoon, everybody.
It looks like we got 24 new cases today. Cassandra, is the mayor on?
No, not yet. There's quite a few missing.
He hasn't logged in yet. I'm letting everybody in as I see names pop up.
Cassandra, I emailed him and he sent me an email back saying that he was able to get in. Oh, maybe he wasn't able to get in.
Oh,
Yeah.
I wonder.
Yeah, he might not be able to get in because I emailed him.
And I know he has the link.
The one thing it required me to do is to download new software to update my software. So he may have to update his software. And then it didn't let me in. Once I updated my software, I had to go into the bottom link.
I have a Dr.
I have
Taylor
to-
calling me. Hold on one second.
Okay.
Dave Romero, can you hear me?
Yes, sir.
Smile.
Commissioner,
So who's Dave 1 and who's Dave 2?
I'm Dave number 2.
Dave number 2, smile. Dave number 1.
Hey,
Show Dave number 2 how to smile.
The mayor's trying to sign on right now.
It runs in the family. We have this genio that when we're really thinking, our face goes like that.
Way to go.
I'm not mad dogging anybody. It's just the way the genetics are from my grandpa.
I'm gonna get Cassandra to smile too. Watch Cassandra smile. There you go. See?
how's it going, Commissioner?
Good. How about you?
I'm good.
I like your background.
Thanks.
Nice background.
We were talking at you with your picture.
This is Louis. Can you guys hear me?
Yes, we can.
All right, thank you. Sorry about that. It's 5:03. I'd like to call this meeting to order. Is everybody here?
Present.
All right, would you like to take a roll call for the city, Cassandra? Hello?
She's muted.
Cassandra's muted.
Can you hear me?
Hi, Cassandra, this is Louis.
Can you hear me, Mayor?
No, no.
Okay, hold
You're
on. I
mu-
got out of the meeting to try and get Bill in and.
I can hear you, Cassandra.
You
I
can?
I can.
Can
Okay,
you
I hear you also,
Can you hear me?
Cassandra.
very good. I'm gonna go ahead and call roll call.
Thank you.
Mayor Louis Trujillo,
Present.
Counselor David Romero,
Here.
Counselor Elaine Rodriguez,
Present.
Counselor Michael Montoya, Counselor David Ulivari Jr., Madam Chair Maria Martinez,
Here.
Commissioner
Mr.
Harold Garcia,
Here.
Commissioner Janice Varela,
Presente.
Commissioner Max Trujillo,
Here.
Commissioner Chris Nahat,
Chris was here earlier.
He's
Thank you,
here. He just, I think he's
He's on
muted.
mute.
Okay,
He's on
thank you, Mr. Mayor and Madam Chair. We do have a quorum.
Thank you. I'm still trying to get into the Zoom meeting on a terminal, but since we're all here, we'll get going. Thank you, everybody, for being here. This is a very momentous time for our county. It isn't all the time that we get to meet together as two governing bodies. So can you hear me, everybody?
Yes, we can.
All right, thank you.
Yes.
So once again, the governor last week on her news conference sort of threw the responsibility of getting back to opening up on local governments. And so I was concerned in that together as city and county, we all belong to the county of San Miguel. So in order for us to reopen our economy, the entire county has to be in yellow, as we are right now, in orange. And that's by next week. So I re-listened to her message last Friday, and she wasn't as blatant as she could be, but she definitely threw the responsibility back on the local governments to say, well, this is yours. What are you going to do about it? You know, in order for you to open up the economy, the entire county has to be, moving in the right direction. So I thought I'd call this meeting to order, or call this meeting to see what we could do, all of us collectively, to see how we're going to get from orange to yellow. So I've done a little research on the numbers today with the assistance of Leo. So he was able to help me get some numbers. And so as you look at the whole entire county, of course, today we had 12 more cases. So we're close to, what, 340 some?
We had 24 new cases, Mr. Mayor.
Okay.
Today.
All right. So I'm not, so altogether, it looks like there's 300 and probably 40 some cases in our county. So when you look at that, and you look at the comparison numbers to how many people were per zip code, so every state does it differently. And so I'll give you an example. New York does it by zip code. So they have different classifications per zip code. If you look at 87701, there's 183 cases. That was as of this morning. It may be a few more, but so the rest of them are in the county. But again, collectively, the entire county, they're doing it as that for the entire state of New Mexico. So we're counted in there. Las Vegas, Pecos, of course, Conchas, Rivera, Villanueva, all the other places that make up the San Miguel County. So with that being said, there are a couple of things that I wanted to discuss, and you guys can feel free to jump in at anything, but you know what, I'm remiss. I guess we should have had a Pledge of Allegiance. So before the meeting gets going. So why don't we take care of that right now? And can I ask the Janice to lead us in the Pledge of Allegiance, please?
Sure, Mayor, you got me off guard. Sure, I'll be happy to.
Sorry.
I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. I salute the flag, the state of New Mexico, and the Zia symbol, the symbol of perfect friendship among united cultures.
Muchas gracias, Janice.
De nada.
Bueno.
Mr. Mayor, if we can have approval of the agenda, please.
Yes, I will entertain a motion to approve the agenda.
Mr. Mayor, this is Councilman Romero. I make a motion to approve the agenda as presented.
There's a motion on the floor by Mr. Romero. A second, please.
Second.
Second by Max Trujillo. All in favor?
Aye.
Aye. Let's try it again. All in favor?
Aye.
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 All right, thank you. The motion carries. What's going on? Okay. Give me 1 second, guys. Still trying to figure this.
What is it?
All right.
This is Chris Nahar. I went out for a little while. I just couldn't get back in, but I'm back in. But
right,
I've been
thank
hearing
you.
everything that's going on.
Thank you. Okay. So, I thought we'd have a conversation as to how we're going to get there. I had an idea, and is Dr. Ruth Watson on the call? On the meeting?
I promoted her.
We don't see her name.
Ruth, can you hear? Ruth, you're unmuted.
Okay. What, man? Can you hear me
Ruth?
now?
Ruthie, are you there?
I can hear you.
Yes. Can you hear me?
I can hear you.
Okay,
Okay,
thank you,
here
Ruthie.
here I am.
Hi, Ruthie.
Hi.
So one of the reasons why I invited Ruthie Watson is she has a master's in public health, and she's also employed at the university, at Highlands University. So we were hoping that we could get her to do or help us to do a public awareness campaign, something that would be on the radio, newspaper, etc., going on the internet for local schools, the universities, the college, etc. And so she helped to come up with a public awareness campaign. And I'm hoping, Ruthie, that you could take a minute or so to explain the campaign and to see if there's any feedback from the commission and the council, and seeing if we could get the public awareness campaign going just as soon as we can, and that would be probably on Monday. So Ruthie, do you want to take a few minutes and talk to us about that?
Yes, and just a slight correction. I have a PhD. I have a doctorate in public health.
I'm sorry.
So, so thanks everybody for inviting me. And I don't know if I can share my screen, but I did a little presentation for you. And basically what we're thinking of doing with the help of my colleagues, we came up with a real simple, easy campaign for everyone to encourage them to stay put, but go out, and if they go out, to take precautions, but only go out when they have to. And so we came up with an icon of a traffic light, and everybody knows a traffic light, right? Red, yellow, green. Stop, slow down, move with caution, and then go. And so what we came up with was the slogan is stop now so you can go later. And so the red would be stop, emergency trips only. Before people were thinking about leaving the house, it would be stop, emergency trips only. So we get them thinking that if they don't have to go out, that they don't go. And then the yellow would be slow down, move it, slow down. Is there something, especially if they're leaving the house, slow down, think, is there something you can use that you already have? And then the third one then is green. If they absolutely have to go out, it's mask up, use 6 foot distancing, limit the number of places you go, and no physical contact. And then at the bottom, the slogan and the tagline is stop now so you can go later. And we can push this out fairly easily because, again, the traffic light is the universal symbol. Everyone knows what a traffic light means. They know for the most part what those symbols mean. So we're just tailoring that traffic light symbol to our message and making it very simple so that even a child can understand. And ideally, again, it starts out with before you go, and then stop, slow down, go, and then go with caution though, and then stop now so you can go later. So at the end of the day, they remember and they think, well, if I really don't have to, I won't go, because then in a week from now, which basically if we roll it out on Monday, we're only talking about a week. So we're really trying to push this so that people feel that they have some hope and some light at the end of the tunnel, so that they understand that this is a temporary measure for them to be successful in contributing to the whole county opening up again.
Can we give feedback? Yeah. Can you hear me, Ruthie?
Yeah, I can hear you.
I like the idea, and it's simple. And you're right. When I work with my grandchildren, they know the stoplight and what it means. One of the things, and you may have this as you're kind of moving through the red, yellow, and green. But I think what's also very important is gatherings. Limit your gatherings to, what is it, 5? I know, that's going to be hard for some people because they have large families, but at least they do it with caution. But I like the idea. Thank you.
And we can, thanks, Elaine. And we can add that in, especially in the green area, where we say, go, where it says go, green for go. We can again say, limit gatherings, limit the size. We can add that in that green area. This one though is basically based on the idea of staying put, stay at home, right? Stay home, stay safe. Don't go out unless you absolutely have to, because what we want people to think about is, let's say they want to run to the store for one item, right? Is there something that they can use at home that they already have that they can get through for that week, for the whole week, that will suffice? And ideally, that's what we want to do. We want to try to get them to, this is about movement. This one is about movement, but we can certainly tailor it and tweak it to fit that gathering aspect as well.
Perfect. Ruthie, I also heard some comments from the general public when I was talking about this. A couple of people called and they were concerned, and they said that stuff that we're going to be talking about later on down is enforcement and getting law enforcement involved in the enforcement. I don't see Chris on the phone, but we have our chief here. Thank you, Adrian, for coming. We have to talk. Unfortunately, we have to talk about the possibility of doing some law enforcement. As you know, other communities are moving to strict law enforcement of masks and gatherings and et cetera. That doesn't even discount the number of calls I got today about Walmart. People think I could go out there and tell Walmart to put up seats and porches and sunscreens for their customers, and open up businesses, open up for business for our senior citizen community. They were concerned that there were, viejitos or ancianos standing in line outside of Walmart for hours just to get in. There aren't very many things I could do. I did call the management, and the manager has not called me back today, but that's about all that we could do. But they did want to talk about, or us to include in the public awareness campaign, information regarding enforcement. And they also wanted to talk about basic information regarding what does quarantine mean, what does nuclear family mean, staying home with the people that you live with. Don't invite your family over for Thanksgiving. If they knock on the door, send them home. Those types of things that the governor is even talking about today. But, the importance about all those different things associated with public awareness. When the governor, and I was talking to Leo about this and to my brother the other day, when the governor sets out these health mandates and, everything that she's done, it sort of hits you globally. So you're listening to what I see Chris Lopez on. Sorry about that. So when it comes out from the state, it's sort of like the state has a stay-at-home order, and that's the way it is. I think it doesn't hit home until local governments start saying, there is a stay-at-home order. It applies to everybody in New Mexico. It applies to everybody in San Miguel County.
Excuse me, Mayor, can I interfere? I just saw a notation that Victor Reyes from the governor's office is listening. He can't get in, but he is listening, so he's aware of our conversation.
Okay, he said he's on now. I can't
Okay,
see
all
him.
right.
But, thank you very much, Victor, for joining us. Can you hear us?
Ebony, see if you can move him to panelist.
He's switching over right now.
Okay.
Now I'm in. Sorry about that.
There you go. Thank you, Victor.
Sure.
If nobody knows Victor, this is Victor Reyes, and he is well, why don't I let you introduce yourself, Victor?
Sure. Thank you, Mayor. Thank you, honorable city and county leaders, for taking the time to invite me today. My name is Victor Reyes. I'm the Legislative and External Affairs Director for the Office of the Governor. I'm here primarily to listen and to make sure that I'm providing any type of guidance or answer any questions. But I do always appreciate the proactivity that this community has experienced from the very beginning, from the one community campaign and the efforts that happened early on in the pandemic and continue today on all ends. And I want to give a big shout out to all the folks in the county commission and the mayor and the sheriff for all the work that's been done, all the community advocates that have been stepping forward, and of course, we stand ready to help in any way.
Thank you, Victor, and I appreciate you being with us this evening. We promise not to keep this as a long meeting. I'm known for having very short and productive meetings, so we'll get you on your way soon. But what I was talking about with my colleagues here is that the governor has a stay-at-home order, and of course, when you hear it from a governor, or that sort of applies to the entire state. However, I think we need to bring that home. And so I was hoping that Dr. Watson could help us to bring this home and with the public awareness campaign and say, this is a stay-at-home order. This is what this means. I always give the analogy. The other day when I was making a pizza, I didn't have any pepperoni. And so I had everything else on the damn pizza, pepperoni wouldn't have made a big difference, but I started to get my keys and my jacket to go to the store to get pepperoni. And I got close to my vehicle and I said, what the heck am I doing? The pepperoni probably doesn't even fit on the pizza. There was ground beef and all kinds of stuff. I probably wouldn't have even tasted the pepperoni. So I stopped and I said, I don't need to go to the store. Those were totally things that we're so used to doing. We're out of something, we get in our car and we go. And this is something that we all need to do, and it's stop and think, do I need this from the store? Do I have to go to the store? Do I have to do this? Do I have to be, in certain groups and so forth? So the campaign, Ruthie, if I may call you Ruthie, I'm sorry, everybody corrects me when I say Ruth. They said, oh, Ruthie. But if I may call you Ruthie, I think it's really nice to have you and here and helping us with this public awareness campaign that we're going to kick off. Again, I'd like to go back to just an opening statement saying that we're all in this together. We're San Miguel County, and the way we open up our economy and businesses in Las Vegas is only if the entire county goes back to a yellow instead of an orange where we are right now. And so we all have to work together, and the county is huge. So we're tasked with how are we going to make this work, and what do we need to do? So let's and I do want to just clarify something, is that Dr. Watson is not representing New Mexico Highlands at this point. Ruthie came to me one day at the Plaza Park and she said, what the heck are you doing with this? And why are you doing that? And she started giving me ideas, and she said, please call on me, and she went home and she texted me her phone number, and I couldn't think of anyone better to help us with this public awareness campaign, with her terrific background. So just to clarify, she's not representing per se New Mexico Highlands, although we're so fortunate that she's in our community. But going back to this, you know, for everybody here today, can I get some feedback or any comments you want to make about the public awareness campaign? That this is going to be a joint effort, and of course, it'll always be the City of Las Vegas and San Miguel County. So the ads and the radio information and the newspaper and everything will all say City of Las Vegas and San Miguel County. So I'll be quiet for a while and see if there's anybody who wants to add anything regarding the public awareness campaign that Dr. Watson put together.
Louis, this is Scott, City Attorney. I just did have a question. I know we're taking a really broad approach, and we're doing that for the reason of trying to get the numbers down so we can reopen. I guess my question is to the second step or the second phase. Let's say we get the numbers down and we do reopen. Do we have data either? I don't know if maybe Leo's office has access to data, or if the hospitals have access to data, or someone else has access to data. Do we know where these new cases are coming from, how people are becoming positive? And if there was a way to, once we reach that golden, that gold color rather than the orange, we reach the goal, we're able to reopen. Can we take some real targeted efforts, maybe with a scalpel rather than the hatchet, to try to really pinpoint the areas where the spread is going on? I mean, do we know? Is it at Walmart? Do we know? Because I'm just trying to figure out, once we get to that place where we can reopen, if there's a way we can specifically target some areas that are maybe a higher percentage of these cases are coming from. We can kind of take a data-driven approach. So I was just wondering, is that data available? And if so, can we get it? Can we look at it? Does someone need to analyze it for us? Where do we go from here?
Leo, do you want to take that?
Sure. I can't really give much clarity on where we're getting community spread at this point. As we all know, the Department of Health website narrows it down to zip code. 87701 is the brunt of the blow, which encompasses probably 50–60% of the county. We do have a lot of the individuals from the Pecos region that do shopping outside in Santa Fe, but there's no way of telling where we have most of the spread coming from. And I could defer that to some of our health professionals, Matt Probst or Dominique, to maybe give us some advice as far as that is concerned.
Sure. Thank you, Leo. So based on El Centro's contact tracing, so we now do our own contact tracing, not just for ourselves as an employer, but for any patient that tests positive. And this is just fits right in with the data that we have from the state of New Mexico that they use looking at rapid responses. So the most common points of contact for community spread are gatherings. And those gatherings, it's not necessarily mass gatherings. Those are gatherings at work where employees are eating together or not socially distancing. Those are gatherings of families that don't live together. So family members that don't, I'm a family of 6 here in the Probst house, but, to have external family come and be with us, exactly what we see coming for Thanksgiving, those are the main contact points. In terms of agencies, and I see Dominique, saying yes. If we look at, yes, there are higher risks in healthcare facilities. There are higher risks in certain settings of employment in certain sectors. But mainly it's what's happening outside of in places of employment, or if it's within employment, places of employment, it's not the service being provided, such as food delivery or healthcare delivery. It's healthcare workers, having spread amongst themselves if they're eating together or doing things where they're not properly distanced. So that's the overall. And just to point, again, so there's a strong, and Victor can speak to this, there's a strong public social media and public messaging campaign already going with the state of New Mexico, all kinds of stuff out there that, I've been involved with. I think it's great when you tailor it closer to your own culture and your own county. So I love that idea. I think it is, there should be education. I think that's a great thing. I think a lot of the spread is not due to lack of education, though. I think people know what to do, and it's not their fault. It's a pandemic when people are getting COVID, one thing. The other is that there are those that know and are just not doing it because they're defiant. And so I caution using the word enforcement, because when you make it a fight, be ready to fight. So I would rather use the word safety in public messaging, and Sheriff Lopez and I spoke about that earlier, something we've been talking about. Adrian and I spoke after our last call with Victor, and what he has coming in terms of safety officers. But I think phrasing that under safety in those areas that we know that we do have risk. For me, and here in Romeroville, it's the 84 I-25 gas station. That's a tough place to don't hang out there. We know Pinos, we know Loves, the folks that travelers on I-25 are coming through that are higher risk. But I think, again, if we frame it as safety, that's important. And then the other thing that's really important is that Ruthie pointed out some things maybe they don't know. Well, that's easy to do if you have food. If you don't have food, what do you do? If you can't pay your rent, what do you do? If you don't have electricity, what do you do? So, it's about, that's what 100% community is about, and providing access to 10 vital services. So when we're contact tracing, you can't just stop at saying, hey, you're positive, and we contact trace. Our goal is for everyone within 8 hours. All but 2 positive cases throughout the pandemic have been contacted within 4 hours. So we do much better than what we see going on in other places right now in contact tracing. But then now when you're telling people you need to isolate because they're positive, and you're telling their close contacts that they need to quarantine, you can't stop at telling them that. You need to ask them, what do you need? And we've had many difficult situations with homeless individuals, lack of food security. How do you pay the rent, those types of scenarios. So it's about access to 10 vital services in every service sector. When we talk about our county being a county of poverty, and us as city and county government, thank you for coming together saying, how do we provide access to those vital services? I have an org chart that we've been using since April that many of you guys are on because you're leaders on this org chart. But, again, we don't need to reinvent the wheel. We're talking about things like economics. And so if I just scroll down here, you see how we're all connected, all the services, how, Victor's on here. We have our congressional office that helps, city, county emergency services, city economic innovation. And if I come down further, you actually see that we've got names next to these. So Mayor Trujillo is the leader, co-leader with Philip and Commissioner Garcia on the City County Economic Innovation Group. On our safety side, and again, call it safety, not enforcement, please, unless you're ready to fight people. Then we've got Leo on there, and Andrew and Daniel, and law enforcement, of course. I already spoke to Adrian. This needs to be updated, but along with our sheriff, adding Adrian in there. So I think a lot of this framework is there, and a lot of it's already happening, but how do we fully put it together with the support of the city and the county? I appreciate you all for coming together tonight on this meeting.
Thank you. I think it's important to consider those words, for safety and so forth. But I also feel like we've done a lot of safety stuff. This has been going on since March. We've given everybody an opportunity to get educated and so forth. And unfortunately, call it what you will. But I think enforcement is what we need to do. Whether you want to call it public safety or, whatever you want to name it, it comes down to stopping people now and letting them know that we're serious. We have a curfew, in place. And I still notice that there's a lot of cars traveling at night, and I'm sure some people have reason to travel and so forth, and some question the validity of a curfew, but so be that. But I think we need to move into a more the law enforcement involved, whether you want to call it safety or whatever. I think we need to move on to that. We'll talk about that in a while. One thing that Matt talked about earlier, and I spoke to him, is contact tracing. So contact tracing and safety or enforcement, if you will. The city has already identified a few people that we can organize or reclassify, not necessarily classify their position, but for example, the people who work at the libraries, et cetera, that don't have much going on right now, we can move them into sort of these safety positions at the Loves, at that truck stop, et cetera, just observing and seeing what we could do. That's an option, and we're willing to do that as well. The other thing is that we can designate a person to assist or designate a person at the city to be the contact tracer person. And so they would do contact tracing for the city of Las Vegas. So if we have a case at the city of Las Vegas, there would be one person designated to help with contact tracing. And we already said we were going to do that. I know that there's is it a 4-hour or a 2-hour course that they have to certify with to become a contact tracer, or to help us with the contact tracing. We're willing to do that. And I know that the county level, Vidal, I don't know if there's somebody that besides, I know Mr. Maestas helps a lot with this type of thing. I'm not sure if you have someone that you're going to be able to designate as a contact tracers type of person. But the idea is that, and I'll let Matt in a while speak to that, but his theory is that if we all had contact tracers in our own organizations, including Highlands, I think Highlands already has someone designated, United World College, Luna, these big institutions, State Hospital, for example, and if they all got certified and assisted with contact tracing, as you know, the contact tracing at the state level, the governor spoke about that in her communication today. They're trying to improve systems. Unfortunately, they are flooded and they are overrun. So a lot of those systems aren't working the way they would like them to work. So they're looking at improving all those services, which is good to hear. But I think we could do what we can do here in the community, and I think that's one thing that we want to look forward to. Vidal and maybe Mr. Maestas, I don't know if you could talk about committing somebody or reassigning somebody to assist with contact tracing, or how that's happening at the county. But I'll let you talk if you need to.
Thank you, Mr. Mayor, and definitely we can identify employee to assist with contact tracing. We can definitely do that.
Thank you. So then if Matt could assist in helping us get those people set up for training.
Dominique's on. She's our number one warrior.
All right.
The whole region is on the call, and she does many things, including setting up the trainings through Department of Health. There's other trainings, Highlands they used. The one I've done is Johns Hopkins, but again, back to let's do the local thing, right? Let's do it the New Mexico way. Let's do it the San Miguel County way. I think that would be that. And so, this is something I presented to Department of Health and the Environmental Department on Friday at our meeting with the community health centers, recognizing that they're behind and them reaching out and saying, hey, how can we, again, in our partnership with testing, beyond that and flu shots and everything else we partner on, how can we partner on contact tracing? And so that's what we're doing now. And this will be innovative. Again, this is us doing it kind of first, as a county, saying, it's a county by county level thing, very much like COVID vaccine distribution is going to be a county to county level thing when we get to that point. And so we would be setting that. And I think, again, not in a silo, but back to that model that I just showed you in that graphic that I showed you, that it's connected with the state of New Mexico. And so that valuable information and being able to do those things here at a local level within our agencies, and for us as also for our patients, that we then have the way to get that data and information to the Department of Health, so they know those are ones that they can kind of check off their list and get to others on the backlog.
Thank you, Matt. The other thing I'd be remiss if I didn't mention, Ruthie. So I had 2 calls today from constituents, and they're concerned about mental health needs of our community. Apparently, there were two suicides. I thought there was 1. Apparently, there were 2 suicides of young kids, 14 years old, in our community, and you know, they're concerned about that, and they're concerned about the schools opening and all that stuff that we definitely don't have anything, you know, over, but maybe some public awareness regarding, you know, mental health. It doesn't help that we had that horrific murder last week, and that video is still circulating. That Facebook video, even though they took it down, people saved it and shared it with their families and friends, and it's still going around. And just hearing it, I didn't watch it, but somebody at work was watching it the other day, and I asked them to, you know, politely not to watch that, you know, at work or around me, because it's certainly, it's chilling, and it's very, very hard to understand, you know, what was in that guy's mind, and the poor family, and shooting someone point blank, and just, you know, all this stuff. And then these 2 kids that, of course, had the, you know, the suicide, and I believe they were connected. I guess they had planned this together, as what I hear, but they are concerned about mental health resources as well. I don't know what we could do besides remind the listeners and the people who are going to, you know, be consumers of our public awareness campaign, is that there's lots of, you know, there's a lot of mental health providers in the community. And of course, I understand that some of those services are overwhelmed as well, you know, with people trying to get in to see people, but maybe that's something that maybe we could also cover during the public awareness campaign. But I'd like to move on to, and Mr. Romero brought this, David Romero brought this to me. I'm sorry, both the Romeros looked up. I was speaking to Mr. David Romero, I'm sorry, the councilman. I forget the 2 Davids here. But he was talking about perhaps looking at forming some kind of a task force between the county and the city, so that we continue to work together. And if that is something that might be over duplicated through the efforts of like 100% community, we definitely don't want to do that. But we, Mr. Romero brought that up. And David, do you have something to say about establishing this task force, or?
Yes, Mr. Mayor. Hello, everyone. I just, my suggestion to the mayor was that, you know, maybe between the county and the city, that we could put a task force together. And a lot of the task force had to do with, my big issue has been enforcement. And I know, you know, we want to use that term, you know, in our community, but the reality is, it's, you know, there's a lot of, you know, people not wearing their masks, not enforcing some of the governor's orders. We have the problems as to, well, it's kind of been eliminated at the parks, things like that. But, you know, a lot of these things are still happening. And of course, we know that the majority of this is happening within the city. It's a little different for the county. You know, their situations that they're going through are completely different. But at the same time, you know, if we can get any help, you know, any help that we can, you know, it's going to take a group effort for people to understand. I mean, look at today's numbers. We've got 24 here in the county. How many of those fall within the city, we're not sure, but we need to really, jump on this, because I'm afraid, that, it's getting worse. I've been probably one of the proponents of enforcement of a lot of these issues since back in March, April. I know I've been in contact with Victor and, offering any ideas that he might have that we could, enforce here, because what's happening here is our numbers are going up, whether they're going to, a lot of our people are going to Santa Fe, Albuquerque for shopping or work or whatever it is. But when they come here, we at least have to have the authority and take care of some of these issues, because I just couldn't imagine what our health care workers are going through. They're overwhelmed. I know quite a few of them, and 24 is pretty big. To 10 is a lot for our community, and that's the reason for the task force. I know I was in contact with Commissioner Garcia, and he mentioned, and I don't know, what maybe Leo could say to this, but he mentioned that there was an EMS committee. I don't know, if maybe we could use that. I didn't know that at the time, just to where we could start it. Go ahead.
I can touch on that, Mayor. if I
Go
may.
ahead. Thank you.
Yes, Councilor Romero and I did talk about this a couple of days ago. And the county and the city have, through the Emergency Management Office, the local Emergency Planning Council. And this planning council has been in place for probably better than 10 or 15 years. There's resolutions that have been adopted by the city of Las Vegas and San Miguel County for this council. And what this council consists of is pretty much what you're trying to do now, what we're trying to do now. You've got people from the county, you've got people from the city, you've got people from the medical field, the law enforcement, the schools, the Department of Transportation, Department of Health. And that committee came up with a plan, and the plan was adopted by the county. I think it was adopted back in 2013, and the city back in 2013 as well. So as you can see, it's probably about 7 years that it hasn't been touched. And that council works directly through the Emergency Management Office. The Emergency Management Office works directly with the city and the county. And so I don't think it would be hard to bring that council back. I understand that it's been a while that they haven't met, but it's a council that is very active. There are a lot of professionals that deal with stuff like this on a day-to-day basis, and we would not have to reinvent the wheel. All we would have to do would be to pretty much refresh based on the current situation. And then this council could be meeting on a month by month basis and reporting back to the city and reporting back to the county on a month by month basis. I really think that when I was the public works for the county, I was a part of it, and it was very effective. Anytime that we needed to do anything that dealt with the two entities working together on an emergency situation, it was immediately done through the LEPC, and it was very effective. So that's just an idea. I mean, I'm open to whatever else everybody else agrees to, but I really think that we could bring that group back and get back on it and support it strongly.
Harold, what was the group's name again?
It's a local emergency planning council, LEPC. And it's, there's a plan that's been adopted. Like I say, I think it was in 2013. And, it identifies shelters in place. It identifies anything that the Department of Transportation can assist with, anything that the Department of Health can assist with. It's got points of contacts in there. Of course, those points of contacts may have to be updated. And maybe Leo can touch on it a little bit more. I don't know because I haven't seen that plan. I've been out of the picture for a while. But there's even certification courses that people can take, the commissioners can take, that public works officials can take that. Anybody that deals with emergency-based situations, there's certain classifications that you participate in and you get certified.
Yeah. Yeah, and I don't know, again, what I don't want to have happen in the community is any duplication of efforts that might be happening. I know that 100% community is already involved in that, but I don't believe that they have a sort of emergency component to their planning. But Matt could speak more to that. But I remember I used to attend the LEPC a while back with my job at the hospital, and so and I don't know if what we're talking about today would actually fit in the LEPC, or if we need to talk about a health council per se, a public health council, or something of that nature that doesn't necessarily deal with emergencies, you know, like wildfires, floods, windstorms, you know, those things that we can see here. But we'll leave that up for in the parking lot. It's a really good idea. And you're absolutely right. The people who were involved in the LEPC, you know, represented several sectors in the community. But what I don't want to have happen is some kind of a duplication, and I'm real concerned about people's times and efforts because there's so many things happening, good things happening, and each group is doing, you know, sort of their thing, and I definitely don't want to do any duplication.
Mr. Mayor?
Yes, sir, Mr. Monroe.
And if I can, I just brought up that idea just because Commissioner Garcia had mentioned that committee was already in place. But I guess my whole focus has been is let's narrow it down to a committee. I know 100% can be involved, but we are leaders between the city and the county, and on the city side, you know, we do, you know, do have authority over the police chief. And, you know, as you know, we mentioned last night, is we'd like to see more enforcement as far as masks, public gatherings, businesses not following that. So, you know, that's, you know, whatever it is, whether, you know, we get members of the 100% communities or whatever it is, I'm just saying if we could put together a team that, you know, could address you know, these issues that we're dealing with right now. You know what I mean? The COVID, the enforcement. I foresee, and maybe Victor could answer to this, is, you know, ultimately, I think it's going to depend upon us on working, opening up for business. You know, once we turn into the green, a part of this plan would be, you know, for us to come up with plans within, you know, as a community in between San Miguel and the city. And that's kind of, you know, my reasoning is, you know, we'll focus on these issues that we're dealing with today.
Okay.
And maybe Matt could have something. Victor has something.
Just real quick, I just put it up because, so yeah, again, so this is the exact current concern. When I showed 100% community 685-page textbook to Leo and Sheriff and said, hey, this has this component that is, as you see it here, county, city services, and emergency management. They're like, well, we already have that from 2013, and you know, and then I said, read the book, and the sheriff read it, and he realized this is not a duplication. This is different. This is coordination. All that is textbook, as Leo will tell you, for a reason, because it's a systematic, whether it's a fire or a pandemic. There's a system to that. This is not in the way of that. This is augmenting that, and it is a committee. And so, and again, I had already asked Adrian if he would join the committee. Now that he's a member in there, this needs to be updated. But that was the idea. And back to the economics, that's on this side, right? And so you see over here, county city services for county city services and emergency management. And then on this side, what you see is city county economic innovation, which is again back to the reopening and that part. And so I see that, and names could absolutely be added. These were about leaders. Every one of these action teams, and you said about a healthcare council, we're already doing this. So every one of these action teams, you'll see leaders on here, but we have meetings with 30, 40 people on the line. Mental health care, they've got 40 some members of the mental health action team. They meet every other week. Everything that Louis just mentioned, they're already working on. I mean, to respond to the issue that we just had with the suicide, we were already mobilizing with the Office of School and Adolescent Health at the state of New Mexico to get this thing called the Just Health Screen. Every child in San Miguel County screened with this tool. For those that can't reach out or are not reaching out for help, we proactively reach out to them. That's one of the things, that's the fruit that's coming out of those things. They have a full resource guide. All of the resources for all of these action teams are online. We have an online resource guide. We have a call center that's manned 12 hours a day that also provides that information. And I'll let the sheriff talk about that. But if someone calls 911 dispatch and they're having issues with any of these things here, then it gets routed to the call center. So again, definitely, I'm not worried about turf. This 100% community is not about turf. 100% community is about everyone working together for everyone, which is exactly what we need in this pandemic. And so, yeah.
So if you may, I would just like to maybe talk to or let Commissioner Garcia and Councilman Romero maybe get together with Matt and maybe the sheriff and the chief, just to maybe talk about forming some kind of a council. Is that fair enough?
I'm willing to do whatever you want us to do, Mayor.
Okay. I appreciate that, Harold.
Mayor, I'd also like to add, with the 100% community and the work we've been doing since the beginning of the pandemic and its start, we're working on a very strong public awareness campaign with the newspaper, our websites, the city, the county, the sheriff's office, and also on the radio quite a bit, spreading awareness about the virus and its effects and what to expect and what to look for and what resources were out there. I'd also like to mention that going through this pandemic, we also talked quite frequently about past models and what we're looking at and that we were eventually going to get to the point that we're at right now. Seeing these large spikes and hopefully, this is the spike that everybody's been seeing in those past models. With that being said, I'd also like to mention the fact, because it isn't talked about enough, that we're leading a statewide effort with the 100% community. And when I say we, the county, the city, we're leading a statewide effort on how to combat this virus, what we're dealing with. And so we are doing a lot, and you look at, approximately 20,000 tests that have been completed, approximately 340 cases, and where we're at in terms of Yalo compared to the rest of the state and the number of population and the number of tests that have been administered, we're in a really good place. We can always strive to be better. We can strive to get into the green. I'd also like to mention the fact that, I hear all this talk about, that you're wanting more enforcement. When you start talking about enforcement, I work very closely with my law enforcement partners. I haven't really had much of a chance to talk with Chief Crispin about this, but I can tell you I work very closely with state police. My staff and his staff they do work very tediously on enforcement. And to be quite honest, we don't have that many issues here in our area with enforcement. People are pretty compliant. When it comes to citing somebody, it is what you consider a petty misdemeanor, and it has to be committed in our presence. So that does make it a little bit difficult at times, but I can assure you that we are working towards that. I can also assure you that we aren't being overwhelmed by any means in terms of enforcement. When we talk about maybe providing assistance to us, that actually excites me because we really could use assistance. I know you had mentioned some cases that we've dealt with here in the recent past, very unfortunate cases, and a lot of that has to do with maybe being undermanned, understaffed, which I think you could probably ask anybody on this call. They're probably all dealing with it, medical staff, hospital staff, law enforcement staff, and that does pose a difficult situation, in terms of mental health. I even have my staff talking to people, you know, because they're living this awful time as well. So, you know, the point is we all have to work together and we all have to communicate. I know we get calls, we go look at it, and we have to make a decision whether there's a violation there or not. What I have been seeing is a lot of the time when you look at what's called in and when you actually go look at the facts, there's not enough there to cite. I can guarantee you now, listening to the governor's orders and her wanting us to pick up enforcement, of course, that's very much taken into account. There has been a lot of warnings issued. There has been a lot of education given, and that has definitely been in our mind. But I can assure you that we are doing our part, and so I hope that there's not a thought there that we're not.
And there's never that thought. I think you know, if I misspoke or maybe shot blame at anybody or shot any shade to anybody, I apologize, since now, you know, and it isn't that, but it, you know, when we look at enforcement and we look at the number of citations that we've given, you know, to people without masks or large gatherings, we just haven't. There's no citations being issued.
You're right.
And so, and I know it's at the discretion of the officer, and I know it's at the discretion of a law enforcement person to say, do I cite this person? Do I just tell them to put their mask on? You know, at some point, when do we start issuing citations? And when do we start taking this seriously as enforcement? You know, it's been since March. We've given all the public notice. You know, we've talked to people. We've put, there's ads all over. There's a mask mandate. There's, you know, we were the first in the state to have a mask mandate. There's now, and 2 weeks later, the state mandated a mask. I mean, at what point do we decide to step this up and to start issuing those citations? You know, and that's my concern. And that's part of what we're going to talk about on the third piece of this agenda. But I think that we all need to be honest with each other here. You know, I really believe that there's room for law enforcement or safety involvement, whatever you want to call it. And so we're looking at, you know, redesigning some of our employees to help with enforcement, or even just reminding people when they're walking into places, those types of things. You know, if we have to use code enforcement people, we have to use the people that are working from home, you know, to help us with this. At some point, I think all of us as colleagues need to call a spade and say, it's time that we move into a law enforcement. You know, if you're breaking up a party, everybody in that party that's not wearing a mask and the person hosting the party should be cited. You know, these college parties that are happening, anytime they're called out, those officers should line everybody up and give them tickets. I'm sorry. You know, I partied my tail off in college, and I enjoyed every party I was at. But we're living in a whole different era right now. And so I really think I don't want to make anybody uncomfortable, but at some point, I think that we need to talk seriously about enforcement. At this point, what else is left? You know, what else is left? I think being nice, walking up to people that don't have masks and saying, you know, hey, we have a mask mandate. You know, we have a mask mandate. You know, they're citizens. At what point do you stop doing that? And I know you want to limit exposures to your officers, but your officers are wearing masks. You know, does that stop them from getting the virus? Well, 75%, as Dr. Scray said today. You know, you're 75% safe if you're wearing a face covering and the person that you're confronting is not wearing a mask. And then it goes up to almost 100% if both of you are wearing masks. So I think as law enforcement, both county and city, I think we really need to open up this dialogue and see how we're going to move into that phase. If you want to call it enforcement, or you want to call it public safety, or whatever you want to call it, but you know, let's all be honest with each other. I don't think any of our law enforcement agencies have issued citations. And I'm not calling anybody out. I'm just saying, and I know because you've all done a good job and you are calling people and you are approaching people and you are telling them, hey, put your mask on. You're trying to be the nice guy. Hey, go home. What are you doing out at 3 o'clock in the morning? Those types of things, get your butt home. I think now, I think it's really time that, that we move into a more, these are drastic times. They require drastic measures, and I'll open the floor up to anybody.
Mr. Mayor, if I can, I'm gonna have to drop off soon, but I do want to just in closing just give some kind of maybe some suggestions and some comments. I want, first off, I want to echo what the sheriff said and what the entire community is doing. 100% community is definitely a model of ways that other communities can come together to join forces in really promoting best practices, promoting efforts that we know are important and critical, like contact tracing, like providing mental health services. It is critical, and the work, I think, is one of the reasons why you're not in the red right now, like so many other counties are and so many other communities are. So I want to say thank you from the bottom of our hearts for that work. It's really important. To the point about enforcement, I agree that there's at a certain point we really do need to look at how it is that we use that as a tool when it comes to human behavior, because we know that we know right now is that human behavior isn't changing. We heard earlier the question, where is this spread coming from? And the answer is, yeah, I think small gatherings are a huge part of it, but it's an all of the above. The answer is all of the above, right? And so if we're really looking at creating a way forward, once you're right, because you're right, there is a horizon, right? There's going to be another week of this pause of these more intensive restrictions. And then we'll see, there likely be communities like San Miguel that have the opportunity to reopen, and rightfully so. But at that point, how do we make sure that, maybe through 100% community and a partnership with enforcement, I think it can all work together in saying, how do we make sure that businesses are doing all of the best practices? How do we make sure that they're meeting the floor of what the public health order is, what the law is, right? And how do we make sure that people know that these aren't just recommendations, it is the law of the land. And that enforcement piece is a critical component to it. I know that we've all been doing everything that we can be doing, and I'm here asking for maybe a little bit more, like I always am, and I do it because we all do. We all care about the health and safety of our communities, and so we're trying to do a little bit more. And so I think looking at that, how we can make sure that we are enforcing, and we're trying to get that mass gathering restriction lower. We're trying to make sure that we're are making sure that folks are wearing masks, that they're following the occupancy restrictions that are that are supposed to be in place at local businesses, and they're following the other restrictions when it comes to the order that are put on different businesses as we begin to reopen, and we see that phase of reopening are really important. And so I commend you all for having this conversation. I think it's an important conversation to be having, and I'm very appreciative of the leadership of everybody that's been on this call. I'll also say I also get, we hear really clearly the need of, from the other perspective, that people have needs, and that businesses being closed and livelihoods being put on pause causes hardship. It's one of the reasons that we called this special session this coming week. We're hoping to give more support for folks who are on unemployment, folks who are experiencing housing needs, give more rental and housing assistance, utility assistance. We're hoping to be able to give more support directly to our small businesses. So we're looking at all of those things. So I want you to know that that's coming. But it is the more that we can tailor an approach to making sure that we're covering all of our bases and using the public health order as a floor and not a ceiling for the work that we can be doing, and really making sure that people understand that it is the law. It is clearly something that we should follow, I think is extremely important. So I think most of you know how to get a hold of me. If not, my contact information is pretty readily accessible through this group. So feel free to reach out to me. And I'm really sorry that I have to leave early, but I have a call related to the special session here. And so I appreciate everybody's time and having me on today.
Victor, thank you.
Victor. Have a good night.
thank you for attending, and please give the governor our best regards. And she's doing a good job, and we need to get behind her, and please let her know that San Miguel County and City of Las Vegas are right there with her.
We feel it. So I appreciate all of you. Thank you, sir. Bye-bye.
Gracias, Victor. Bye-bye. If we could get back to the subject, I just maybe want to hear from the chief, Adrian, regarding enforcement.
Good evening, everybody. One of the things with enforcement that we've been seeing is there are a lot of people out here, or a lot of our citizens are complying with mask usage. The people that we're seeing are the people that are coming from out of town, Texas, California, everywhere. On the plaza, we have vehicles with license plates that these people are going to be reminded, hey, put your mask on. It's a mask, mandatory mask usage here. And they'll walk into like the JC's area and they're walking back because they don't have a mask, and JC's is telling them. I think one of the most important places, or the problem place that everybody calls, is Walmart, right? So with this 20%, their maximum capacity was 554 people at one time in that store. Once it went down to 75, 6 a.m., you have people wrapped around that building because they're waiting to get in. We get calls over there. Everybody's wearing a mask. I spoke with the manager. He said that he is allowing people with medical problems that aren't wearing masks, and I think that needs to be kind of changed with them, where like Costco and those big box stores in Albuquerque are making everything mandatory for a mask. I think that's one of the ways that we can ask them to start enforcing at Walmart. For us, I don't see my officers, and this is just me, I don't see our officers getting into a fist fight or some type of use of force in reference to wearing a mask. You know, some of these people, you know, it hasn't happened yet, but when we talk to these people, they're like, well, you know, we don't like the police. Who else is going to enforce these or bring public safety to the limelight on the mask wearing? And like I was telling the mayor, it would be a good idea to have someone else besides law enforcement to be out there trying to talk to people. Myself and Chief Montoya, Billy, we've had an agreement that they would check capacity, and if there was mask enforcement to be done, we would go in and do the mask enforcement in any business that's around town. Right now, you know, we see the compliance. We see that they're using masks. Now with this shelter in place, there's still people out and about, but they are wearing their mask. And so we really haven't had to do that much enforcement. I think if we really knew where we had to target, we would deploy our officers to that area. So we would be able to target that area. Yeah, Love's probably one of the major is Love's, but we go out there and there's you know, those truckers are wearing their masks. It's hit and miss, correct, with anything else. But I think that with the enforcement, I just don't want to see my officer get into a use of force issue with the mask. Also on gatherings, we all have to be responsible for gatherings. Like I told when we were on the line with Victor the last time, it starts with us, yes, but when my officers go to a political figure's home and tells them to shut it down, and that political figure comes to them and says, no, just leave us alone, get out of here. We don't want to, you know, it's a family gathering. So those are the type of things that we are encountering out there in the city. So we're trying to do something for our city on the enforcement side, but I just don't want to see my officers get into a use of force in reference to citing. Also on that, once we cite this person, what do they usually do? Walk away. They have 30 days to go to court, and then whatever happens in the courts happens with the court. Is it dismissed? Is it a warning? Is it pay court costs or you know? I think that fine would need to be heftier for us to really make impact on on citations. But that's my opinion on this part.
Yeah, and you know, definitely. I mean, I wouldn't expect an officer to get into it with somebody and pull out a gun and have to get into that situation. I think that's a very extreme example. You know, but there's nothing wrong with writing a citation to somebody. You know, and just saying, you know, I'm sorry, you're not wearing your face mask. There's a mandate and you have to wear one. And you guys can correct me, jump in if I'm wrong, but you know, I think the use of force example is you know, I think that's drastic. And yeah, if there is a standoff or somebody gets, you know, upset or whatever, it's not worth giving a citation to that person. Your officer can walk away. But how, and I'll leave it up to you guys. You tell me how we're going to enforce this, or you tell me how we're going to public safety this issue. And you're saying everybody's compliant. Everybody, you know, that all our citizens are compliant, but there's our numbers don't show that. You know, yes, we're in a good county and maybe we're not red. We shouldn't have to be red. You know, but I think the reason we brought everybody together here is to talk about strategies as to what we're going to do. So maybe maybe I could just leave it up to you guys to tell me, you know, what's fair. If you see somebody walking from JC's without a mask, you know, do you tell them? Do you issue a citation? Las Vegas, Nevada, if I'm jaywalking, they're going to give me a ticket. You know, I mean, that's just the way it is. We have state laws and mandates to follow. I'm just wondering what the best way of safety or enforcement is, and maybe I'll be quiet and let everybody else jump in.
Mr. Mayor, could I add something? Just a comment as to, you know, we're all leaders in our community, and you know, it starts with us. And you know, I brought this before. You know, we do have our issues at the city. You know, as far as enforcement, if it's you know, I'll tell Chief Adrian and Sheriff Lopez, you know, any of my family members aren't complying, issue them the citations. You know what I mean? I think, you know, it starts with us, and you know, we're the leaders, and that's the way it should be. There should be no political figure. And I'm sorry, you know, I don't know who Chief Crispin is talking about, but you know, it starts with us. And you know, don't do any of us any favors, because ultimately, if that's happening, the community knows about it, and we're not leading by example. And maybe that's why we are where we're at, is because they don't take us seriously in what we're trying to do here. And I just needed to make that comment.
Mr. Mayor, I have a question.
Yes, sir.
To the law enforcement members of this panel, to Sheriff Lopez and Chief Crispin, under what citation or under what statute do you cite? I know there's a difference between municipal and state statutes. And what are the potential fines and court costs? Are you aware?
So if you want to answer that, Sheriff, or I could answer that, whichever. The statute that we go under is the state statute under the health order 29. I'm not sure what it is right off the bat, and it's $100 fine. It's $100 fine to magistrate. So everybody would be cited into magistrate court.
Magistrate court. That was my question. So
yeah. So everybody would sign that into magistrate court. So we'd be issuing a, and you know, for municipalities, we have to file a criminal complaint or a statement of probable cause with that citation. So okay. Because we have to do the criminal complaint would have to be issued and then sent to magistrate court, or we use a traffic citation and send that in with that. So
if I could just give, you know, again, I agree that the extreme, but that's real things I've encountered when I ask someone to put a mask on, where they say masks are for scared sheep like you and for wimps, and I don't believe in masks, and you want to fight, you know. So maybe law enforcement doesn't get that same response, but I've literally received those responses. because people have this very polarized belief. So that's extreme on one side, but I want to give the extreme on the other, which is these are real citizens of San Miguel County, and I can tell you that tell me, well, I don't wear masks. Well, it's a real story. Leo knows it. I wear masks, and Dominique knows it. I wear masks when I'm walking around town and I find one on the floor that looks clean enough. So, you know, before you issue a citation for someone not wearing a mask, and 100% community since the very beginning did that, was provide masks for law enforcement to be able, when you have a citizen, when you have a resident that needs a mask and says, where's your mask? They say, hey, I don't have one, you know, and they say, here's a mask. Oh, thank you so much. You know, put that, and then they put their mask on, versus someone that wants to fight you because they believe it's their right to not wear a mask. And so I just want to make sure, you know, again, my point is that all of that's taken care of. And I think that the extreme on the other side, again, I see that. I think we can't build a wall around our county, but we have an I-25 running right through our hearts and an 84 coming in on this other side. And folks that in their counties and their states, they don't have the order we have here. Yeah. And so I think that's another very important piece, back to honing in. That is an area that could really use some enforcement, or as I call it, safety is enforcement in that case.
Okay, so
If I could chime in, Mayor, just one thing, please.
Yes.
I'm very much in agreement with the mayor in regards to enforcement, because my concern is for, you know, small businesses. Small businesses, when we're going into Orange, you know, they have to shut down. They're going to be losing their businesses because of that. So I understand we have a responsibility to all residents, but also residents have a responsibility to our community to follow the rules. So, because it has a larger impact on our businesses. Okay, that's how I look at it. Yes. Thank you.
I just add on to what Councilor Rodriguez said, and I'm going to use a different word than either enforcement or safety, and that's compliance. And I think that we are in a unique position because of the governor's order moving the responsibility to the county. When we frame this with our businesses, now they can see why we're doing the things that we're doing in their interest. It's not just, I mean, obviously the most important thing is the interest of the public health, but we can't reopen if we stay orange, if we don't move from orange to yellow. And so they now can, I think that's the message I would like these folks that we're going to designate to go out and visit with the businesses to carry with them. And this also gets to the marketing side of things, is we have something that we can hand to people that makes this point. You know, we're all in this together. We can't let your business reopen or expand. Your Walmart going from 75 to the number the chief said 570 or whatever it was. We can't do that without you helping us. We can't help you if you don't help us.
I would like to add on to that. I would like to echo what Bill Taylor is saying, is that we need to find a way to get the community leaders and those business leaders to buy into this and get them involved. I think if we can get them into this and really showing that they also promote this and that it matters to them, that whoever follows them, whether they post it on their social media, whether they post it, you know, in the stores directly, some kind of way, if we can get business leaders, the small business owners, if we can get other organizations, Kiwanis, all of those organizations involved, those influencers around town, if we can get them involved in this and get them to buy in, we have a better shot. We have a higher likelihood of them influencing the other people in the county and the city as well.
Thank you, Ruth. Mr. Lopez, did you have a comment? Chris?
Yes, I did. And we do have literature which is handed out. We also have So if a business is not in compliance, and we're able to prove that, they would be cited, and that would be sent to DOH, which in turn they could be subject to a $5,000 fine. Again, like I said, we haven't come across that point to where we've actually had to cite a business, but I know that around the state it has been done. I can also say, like I did a while ago, that I work very closely with state police, and they have people that are designated for that specifically, and they have spoken up as to the fact that they have had pretty good compliance here in San Miguel County as well. So I just want to reiterate the fact that we're out there and we're working on it, and we're having a pretty good success with compliance. So it's not like it's not being done. I just want to reiterate that because it is being done. And I know early on, Mayor, we had that call at the church, which I looked at. Leo actually, I think, is the one that observed it first, but Captain Moncada had been out there, and so it seemed, I assumed they were out of compliance as well. But when we actually looked at the orders, they were in compliance, and I have seen that on numerous occasions where there's people are, because they don't understand the health orders, and that's something else that's a little tricky as well, because they're constantly changing. But I know even what's considered a business that can stay open or not stay open has also been questioned quite a bit. You look at some of the local establishments, whatnot, but I can tell you that is something that is being taken very seriously, and I really feel like, so I'll give you an example. We had a checkpoint some time back, and I want to say probably in that checkpoint, I'm going to say probably maybe 60 to 70% of the vehicles that passed through that checkpoint were out of state vehicles. And I know a lot of times that they're passing through, we have had issues with them and educating them as well. I can say maybe that might be an instance, but other than that, I feel like we've been pretty successful. Again, I want to remind you, we get calls and we go out there. It's what you consider a misdemeanor, petty misdemeanor. And we have to observe in order to enforce that action by law. So it's a little bit difficult.
Thank you. I see Mr. Wagner. Hi, Mr. Wagner, Captain Wagner from the New Mexico State Police. Welcome, and I'm so glad you're here to join us.
Absolutely. How are you, sir? Thank you for having me. I've been trying to jump in, but I just didn't want to interrupt the flow of the meeting. I want to reiterate what Sheriff Lopez and the chief are saying, and especially when we're talking businesses, because I have two guys that are full-time doing COVID enforcement. But what I can say about San Miguel County and Las Vegas, the businesses have been doing real good. They're turning people away, they're educating people, and that's what we've been doing too. So always remember that, and when you guys, if you start these teams, the businesses are on our side. We're all working together. And everybody has to work together, because and as a matter of fact, you mentioned citations. Yeah, we've had a couple where we did issue citations, and it was actually the businesses that called us, and for lack of a better term, the people that got cited deserve to get cited because they flat out refused to put on a mask, and the guys were very professional with them. But it got a little heated, I was told, and I've seen the cameras on a couple. So but yeah, I just wanted to throw that out there for the businesses, that they absolutely are. The ones I've been dealing with, my guys have been dealing with, they've been doing a very, very good job.
From a compliance standpoint, our last meeting with Victor was about our own agencies. So as employers, as larger agencies here, we can force compliance based on our employment policies. So El Centro Family Health did that. We all said we would on that call. And while at work, we can do that. We can control our employees when they're at work and write people up and discipline people, take disciplinary action. The city of Las Vegas doing that. Again, we don't want to be where people are saying, well, I see city employees not doing their things, right? Or I see county employees not doing their things. Or Highlands University, back to the parties. If it's Highlands University, we have a reporting mechanism for that. We need evidence, but they are held as students to a standard. and they can face consequences even as students. And so I think within our agencies, the larger agencies, that's another opportunity for those that maybe not, just like we're saying contact tracing, to say agencies, we're all going to take a stand in San Miguel County together, and we're going to enforce with our employees. I think that's another great thing. And again, it doesn't have to just be the larger agencies, small businesses, that can be a united front.
So let me just ask this. What is the message that we're going to send out from now on? From this night forward, what difference are we going to make? We had this meeting between county and city. What is the message that we're going to send the community?
Mr. Mayor, if I can.
No, you're my bigger brother. I can tell you. I'm just kidding.
So to paraphrase the governor's words today, the spread is fast and exponential right now. The relief and the flattening of the curve is going to be very slow. So we're not in a sprint right now. November 30th is next week. I don't think that we can make a miracle happen. I think we need to look at the middle of November, and I think our message needs to be clear, but it needs to be a positive message, and it needs to be constant. We have 2, 3, 4 radio stations here in town that people listen to. I'm willing to go to the radio station and record a PSA. The sheriff has been doing it. Matt has been doing it. Other public leaders and public officials have been doing it. But I think it's an all hands on deck. It's the mayor, it's the city councilman, it's the county manager, it's the county commissioners. We all need to schedule a time to go and maybe we don't even have to go and record a message. Maybe we can just do it on our telephones, on our desk, and put it on social media.
Max, if I could just keep, I didn't mean to interrupt you, and I apologize, but I think that's what Ruthie Watson is here for.
Well, exactly. I was just going to refer to what she said. Maybe after this meeting, we can, or she can send us out the message, and we should all take it upon ourselves to deliver that message to our circles, to our people, and hit it on every angle that we can. Radio, whatever means of broadcasting this message, and it has to be constant, and it can't stop on the 30th, because if it stops on the 30th, the spread is still fast and exponential. So
yes.
we need to keep this thing going for the next 2 or 3 months.
Thank you. Thank you, Max. And it was like the first night that we spoke about this, you and I, and your message was very clear. It's not, government is coming out to get you, we're the big brother, the big heavy fist, type of thing, as much as we're doing this for you and with you. That's the message, and that's the unity that I think that we need to portray as this group continues and we move forward with this, that it's a positive message that City of Las Vegas and the County of San Miguel are moving forward with whatever it is the message is, and that it's unified, and that we're doing it for the people as opposed to the people, that we're doing it for them and that we're doing it with them. And so those are the type of messages that we want to send forth, and that we're all united, that we're all one community and that we're all united. I want to give some thought to the enforcement, and I'll take some time to do that tonight on my own. I have different thoughts about that for the city, but I'll handle that situation at a later date. But what I want to do from this forward is that from this point forward, and as we come to the end of our meeting, is that I really want to move forward, and that I think in this very difficult time where everything has been so polarized, this election cycle, all this stuff, it just created so much polarization in our minds. I think the citizens of San Miguel County and the citizens of Las Vegas need to know that we're cohesive, that we're coming together, that we're building, that we're, holding up each other, that we're supporting each other, that, Mr. Lopez is here, the sheriff, the state police, the city police, the commission, the council, 100% community, and that's next week we're having a meeting with Vecinos Juntos, and that's bringing in all the educational component. And that's for exactly this reason. We want there to be a bigger platform for the messages that we're going to be sending out. So I think that, moving forward, I think it's very good. It's going to be very important for us to move forward, and if we were all together, we would do that, high five type of thing. And we're in this together type of thing, but I think that's the message that we need to portray to our community and to our entire county, is that we're all in this together and that we're working together, and working for compliance. I liked what Bill said, Dr. Taylor said, we're all going to work towards that. Dr. Taylor, you had your hand up.
Well, I just wanted to piggyback on what you said and what Ruthie Watson said, is we need to use every mechanism, every path to get this word out. And I think that Ruthie talked about civic organizations like the Kiwanis Club and the Rotary Club, and in the business organizations like the Chamber of Commerce, and you hit on the schools. I think that one of the organizations that we haven't reached out to, and I think it may be a little stickier, but a lot of people don't belong to any organization other than their church. And maybe we could engage some of the religious leaders to help us get this message out.
Absolutely, that's a great idea, Bill. So you can't say any bad words, Dr. Ruthie, when you're making your ads. I'm just joking. But we definitely could welcome the churches and help them get them out on get these messages out on a platform.
Mayor, I'd like to suggest something, if I may.
Yes.
One thing that I must say is that this pandemic has brought out a bit of frustration on all of us, and I gotta say that I'm grateful that I live in this community and that I'm a part of this community. And I think that we need to give that message to the residents, because I really appreciate what's going on. Even though the numbers are what they are, it could be worse. And the small businesses are suffering a lot because of this pandemic. They're suffering more than we are suffering, more than we can imagine that they are suffering. So yeah, we're looking at a way to enforce. We're looking at a way to try to get this thing better. But at the same time, I think we need to stretch our hand out and say thank you to the community, because the frustration is outrageous. We had an election recently. Our national leaders were bombarding each other so negatively that we didn't even know what their platform was when they were running. They were just running against each other, and nothing else mattered. And a lot of times the community sees that with us as well. We talk about infrastructure, we talk about anything that's common amongst us, and there's separation. There's always been separation. So this pandemic, let this pandemic bring us together. Not just for this cause. We have issues that are very common among the city and the county.
I agree.
Let's work together on everything, not just this platform.
And I was telling people, I even told the governor's office, this is sort of like just a start. This is just sort of like a litmus test to move forward on mutual governance, issues that affect both of us, the county and the city. And so I think eventually what we're going to do is we're probably going to work together on several different issues, Harold. And
well, let's not say probably, let's say let's do it.
Yeah, I agree. I'm all for it. I have a listener that just texted me, and I don't know if we're up to coming together and making a slogan, but they recommended that we move forward, and that the messages, besides the note, the concept that Ruthie put together, was that we are one, that this community is one. The county, the council, the county commission, everybody moving forward, and that's a message that I think that we can all grab onto. What does everybody think about that? We are one. What do you think?
Mayor Trujillo, this is Commissioner Martinez.
Hi, Maria.
How are you?
Good.
I would like, good. I would like to say, first of all, thank you to 100% Communities for the hard work you guys are doing out there. Next, I would like to say, do our police officers have resources out there? Do they carry resources with them, such as masks, for when they do catch an individual without a mask, to give them a mask so that they, so that they're able to comply. We live in a poor community. Our people don't always have the means to purchase these masks. And, I say, give them a chance. I don't think that we need to be issuing a citation to them right away. If you catch them more than once, well, then maybe. But I think we have to give our people a chance to comply with this order and follow this order. Additionally, for the message that we're sending out there, I would say that we should think of maybe using some of our kids from our community, some of our people from our community, to go on the radio, talk on the radio. What's this going to do if mommy or daddy dies? What is it going to do to our children and our familias? And give this message not only in English, but in Spanish. Hablamos español en la comunidad. Some of our older people don't understand. We need to give it to them in Spanish so that they're able to understand what we're putting out there.
Maria, thank you. That's a very good point. And Ruthie's working with Dr. Eric Romero at the university, who's going to be translating some of the messages to Spanish as well for us. So everything that we put out will be in English, and some will be in Spanish as well. Welcome, Mr. Montoya, Michael Montoya, welcome, thank you. Do you have a comment?
Yes, Mr. Mayor, thank you very much. I've been on, but I wasn't on camera. First of all, I witnessed yesterday when I was going to City Hall that we did have a crowd of individuals with 3 officers present. And the officers were all using their masks. But the individuals around, there was a group of 6 without masks. And then there was like a group of 12 around the officers, and 80% of them did not wear a mask. It was pretty upsetting. I do agree that we got to start citing people, because it's come to the point to where it's a life and death situation. We've been at this too long already. Another thing, Mr. Mayor, I wish that you would have included the city of Pecos and also the community of Mora and the community of Wagon Mound, because the county and the city are the hub for the northern part of the state. And they're so close or nearby us that it impacts them too. And whatever they do impacts our community. Mm-hmm. Just so that they can be abreast as to what's going on overall and see what they can do in their communities. Because a lot of people do travel back and forth. Now, going back to this emergency trips only, slow down, stop, and must, if you must go. I believe that like every community, every business should have a card, and in that card, there should be a pledge saying these things right there. Plus, I'll be wearing my mask, or I'll be washing my hands. And when people come into the motels or to the businesses, that's the first thing they have to sign off on. And it's a little pledge card just saying that, whether it's at Walmart, whatever business it is. And also maybe we can put one on the Optic, Las Vegas Daily Optic, so that we can send them to their homes. They can cut it off and put it in the refrigerator. Just a reminder and a pledge that I'm going to be one of those people that I'm going to help my community. Those kind of things I think would help. But of course, like Commissioner Max Trujillo mentioned, do anything possible. And Commissioner Chair Maria, the same thing is we got to promote it with the churches and with our youth and our leadership and so forth. I think if we go forward being positive about this, I think the end result will be good. And I agree that our businesses are behind us because they're the first ones that want to reopen up their businesses. We've helped them out with COVID monies and stuff like that, but that's not enough. So those are just a few of my comments, Mr. Mayor. Thank you.
Thank you,
Mr. Mayor.
And I just want to, I'll be right with you. Sorry, Mr. Ulibarri, but the main reason for getting together tonight, and I'm sorry that the mayor of Pecos is not here. I understood he was invited. But the main reason for us being here tonight is to open up our economy and to do it safely. And I want the business community to know that that we all share the same sentiment, is that we're doing this so that we can move to yellow and so that we can reopen our economy just as soon as possible. So tonight is just, probably the first meeting that we're going to have together. But you're exactly right, Mr. Montoya, that, the reason for us being here is so that we can open up safely. Absolutely.
Mr. Mayor.
Mr. Ulibarri.
Good afternoon, guys. One thing that I like to say is la gente from our county and our city, I would say that they're coming out from our county, and it's 4 or 5 families that need something from the county to the families. They can make a list and have one of the family members pick up what they need. It's in the grocery stores, whatever necessities they need. That would be nice because, that way you don't, not 10 or 20 people of the family will come in and buy stuff. That way it would slow the epidemic on our county and our city. Another thing I want to say is use common sense. Use common sense on what we do, where we go. Our kids, our grandpas, our grandmas, talk to them every night, tell them what's going on, tell them how bad this stuff is, because this can kill our families, our grandpas, our children. We got to be aware about that. And the thing is that if we don't put an effort and talk to our families, what's really going on, and do the socializing, not too close to people and everything will be good, but it's going to take time there. I want to thank the county and the city y toda la gente de los ranchitos y todo que cuiden a su familia. Thank you for everything.
Thank you, Mr. Ulibarri. Thank you for joining us. I appreciate that. And you're
Mr. Mayor, just real quickly, Eric Romero, he's 100% community for culture and tradition. We have to have that because we have to be culturally sensitive. So again, that's already part of it. San Miguel County, 100% community. Pecos is part of San Miguel County. They're already part of it. Commissioner Varela was on our call just this past week, and that's an important part. We've got the clinic there involved, the schools. Our education action team is one of the strongest action teams of all the 12 action teams right now, and meeting regularly and doing all kinds of things together. We have tentacles that go to Mora, and we've got, trying to form a 100% community there, and, Wagon Mound, Anton Chico, those areas as well. So, absolutely, your message and saying, well, what is our message? And thank you for saying, Max, saying a message that's positive. Our message is about reopening the economy, as you just said, but should be a message of hope, because of all the efforts that we have done. Look at the map. There's only 8 counties left that aren't red. And look at that northeast quadrant there. That's not a mistake. That's our community right there.
doing things right and positive, and we have a chance to open that others don't. We're in a different situation now. A number like 24, it'll turn us around real quick if we don't get on that now. Right now, we got to move, but there's an opportunity here, a message of hope. And I love what you said, Mayor, in terms of saying we hold each other up and we are one, whatever that is. Rise Up right now, we have West Las Vegas students, with the trauma they're going through, rallying and coming together. But absolutely, that's it. A message of truth, a message of hope, and of all of us together.
Thank you, Matt. I appreciate it.
Mr. Mayor.
So if
Mayor.
all of you would agree, Cassandra, I'm not sure if you have access to everybody's email that's here.
I can get access, Mayor.
Okay. If you would, please. And the reason why I want to put all these people in connection with, to connect them with Ruthie Watson, and Max has a good idea, about those public awareness ads that are going to come out. And if you know Mr. Varela from Pecos, welcome him to do some radio ads too. But we'll be in contact soon as we roll out this, and we really want to get this going as soon as possible. We'd like to have stuff on the air by Monday. That's a big feat to do. If we absolutely cannot do it by Monday, then hopefully by Tuesday. But so we'll be in contact with so that we can put out those public awareness ads. And again, Mr. Lopez, Chris Lopez, I hadn't heard any of the advertisements that are on the radio, but I've seen some on the newspaper, and I think they're very nice. And but thank you for reminding me that those ads are out there too. So does anybody have anything else to say? Does everybody?
Mr.
agree?
Mayor.
Yes.
This is the county manager. I did invite Caleb O'Rear from Alta Vista Hospital. I don't know if he's on or he has a representative, but I would definitely like Alta Vista to give us an update on their status for COVID response, but I don't see him on.
Okay. Yeah, I know they've been very busy, working with everything that they got. And Dr. Martinez, thank you very much for the county, for getting the county together and helping us with getting this meeting going. And I can't thank you enough. This is a very historic moment in our community. I can't remember when the city and the council ever met together. I mean, the council and the commission met together as one group. And so this is really great, and it couldn't have happened without each of you. So I really appreciate that. Dominique, you just popped on. Is there anything? Hi, Luella Reed from the hospital. Welcome. Thank you so much. Luella reminded us that Alta Vista is present. Thank you, Luella. Dominique, do you have anything to add?
Hey, Louis, I've been here. I just want to say thank you guys. Thank you, Matt. I do agree with what Matt was saying earlier, that we have been seeing the numbers, or the cases that we've been testing are because of the gatherings. I will also work on seeing what I can do to get you guys training for contact tracing. Right now, the DOH training is what we're going with. And we definitely don't want to duplicate efforts. If you guys feel that you want to do a contact tracing internally, just remind them that the DOH staff will also be contacting them for further information as well. So there's that. So I will see what I can do to see if we can get you guys the DOH contact tracing, because that would include having you guys get into all our database systems and things like that. So I don't know how much more training will go into that, having to do HIPAA and things like that. So not sharing that information within the employer facility. Okay. And I think that's it. Thank you guys. I know Leo has given us masks because sometimes we do have people coming up for testing and they're not wearing masks. So we do, thank you, Leo, for giving us masks. We've been handing them out. We are still providing services here at the public health office. So if they come without a mask, we're also offering those out. But in the same note, like Matt said, we have had people where they're saying, while I'm using whatever I found on the floor. So I think there are still some people out there that need masks. So if we can get those to law enforcement to hand out, I think that's a great idea rather than just hitting them with the citation right away. We are doing we're going to be having a flu outreach event on Saturday. I know we were working on getting more masks. So if there are any, we would be willing to also pass them out this Saturday during our flu outreach event. We continue with testing here at the PHO and doing rapid responses out of our health office as much as possible and helping in other areas all the way up to Raton. So if you guys ever have an employer that is positive, give me a call. We can work on how we can do a rapid response. We are also now working on calling more of our positives more quickly. And they have started sending out text messages to the positives. That wasn't happening initially, but now I believe that it is from my understanding. And so kind of just giving that message, you are positive, you need to stay home, self-quarantine, don't go out, don't go out, period. And then we have our case investigators, which are different than the contact tracers. So the case investigators actually need to have contact with the positive before the contact tracer has contact with them. So there's kind of two steps there. And the contact tracers actually don't have contact with the positive person. They have contact with all of those who were exposed. So it's a pretty big process. Our contact tracers follow them for the remaining days of their quarantine, calling them every day, checking on symptoms. Did you get tested? This is when you should get tested. And so there's a lot that goes into the contact tracing. It's not just, oh, okay, you were exposed, we need to get you tested. It's a lot more than just that. So thank you guys for having me on. Thank you, Leo, for inviting me. If you guys need me, I think most of you guys have my number. You guys know how to reach me. And that's it.
Dominique, I just want to mention that you're one of the people who hit the ground running, and I think you've been running since March. Are you tired? She has been at the forefront of everything, and I'm telling you, when I say she hit the ground running, she's been so good to contact and helping us with testing at the city. And I mean, she's the go-to person at DOH locally, and I can't thank you enough, Dominique, and your team. You've just been fantastic to work with, and slow down. I hope all this stuff you get to slow down because you're running still, and we all are. But you definitely have hit the ground running, and it's people like you that need to be recognized for the wonderful job you're doing.
Thank you, Louis. I appreciate that because some days going from Los Alamos all the way out to Clayton, those days are exhausting. So
I know.
I'm hanging in there, but
Hang
thank
in
you for
there.
recognizing that.
We'll
Anything that I can do to help keep our community safer.
We'll send you some good energy this evening.
Thank you. I need it. Energy or prayers,
you.
whatever you go by.
Oraciones también. We'll send you some prayers.
Yes, thank you.
So I'm looking at my calendar. Do we want to have like I was thinking about December 3rd, Thursday, December 3rd. If we want to come back together and meet for a shorter meeting, that one I promise to be an hour. It would just be to sort of find out how things are, where we're going, if we need to beef up something, if we need a better response at certain places. What does everybody feel? Is that doable?
Yes.
Is this a good time?
Yes.
Okay.
Mr. Mayor, I just want to ask, you challenged us with getting the message out by Monday. Do we have some people in mind as to who's going to take the lead on that?
So of course we can't do it without Ruthie, but we definitely would like to see if Virginia could assist, Virginia Marujo, with the graphic stuff. And I think her and Ruthie need to meet pretty quick and help us with the graphic design. We just happen to have the one of the best graphic designers on our staff, Virginia Marujo. She's does a fantastic job. So for her, for sure, who would like to be the contact point at the county so that we can contact people to do ads, etc. Any volunteers? You know what happens if you don't volunteer. Vidal, is there someone in a clerical position or that could assist in communicating with the commission? I know you do all the time, but you're muted.
Most definitely, we can work with Leo Maestas and we'll identify someone to assist with that.
Okay, very well. And so any other last thoughts, any threads out there that need to be spoken or talked about?
Mayor, before we close.
Mayor Trujillo, this is Commissioner Martinez again. I would just like to say a little something. Let's not forget.
Maria, you're breaking up. I don't know if there's some background noise where you're at. Maria, can you repeat what you're saying? Maria, we weren't able to hear you. There you go, Maria. Maria, can you repeat what you said? Maria.
Not working.
We hear you now. We hear you now. Okay, who else?
Mayor, just one more thing.
Yes, Harold.
Thank you for bringing us together. And then one more thing, I'd like to say thank you to our law enforcement people. You know, we've had a rough few incidents that have occurred, and you know that our law enforcement has been there, and they're the ones that are on the line, and you know it's been serious. It's not something that hasn't been serious, and so I just wanted to say thank you to our law enforcement for what they do.
Absolutely. Thank you so much. They've always been there when I've needed them. Thank you so much. Anybody else?
Mr. Mayor.
Mr. Romero?
I just wanted to, first off, again, thank Matt and Dominique for all their work. And I think, your commitment and Dr. Taylor's, whatever resources they may need from the city, I think, we're willing to help out in any way. It's all for our community. The other thing that I had is maybe as far as I know at one time the Optic had offered to help out in any way, if they can. To what extent, I don't know. Maybe we could have those conversations with them, with either Phil or I think Amanda. And the last thing I know that Mayor, you had went ahead and let me go ahead and talk to Loretta, and we're trying to work with on doing a Zoom meeting with the Walmart, the Loves, some of these other big businesses that we kind of feel that we have issues with. So I don't know if maybe somebody from the county would be willing to participate in that and just have those conversations with them, as Ruth had mentioned. And I apologize to the law enforcement. It's not that we weren't saying that we need to put the hammer down, but if we show a physical presence and whatever, at least showing that physical presence, I think that would eliminate a lot of these businesses that are not following the orders as they should be. But we'll have those conversations with those businesses, and if somebody from the county would be willing to also join us, then I'd ask of that.
Councilor Romero, let me know when you will have those meetings, and I will be there.
Okay, thank you.
Thank you so much.
Mr. Mayor, Chief Crispin, just real quick, I just want to thank Leo from Emergency Management. He's provided us masks so we could give out to the public when we see them without him. So most of our officers have some are empty. So Leo will be calling you for some more if you have any. But that's just to reiterate to Commissioner Martinez that we are giving masks out there to our public, So even if they need one, they could stop by our police department. We'll give them one, the one for the ones. I think one of the things that I heard yesterday by Coach Richard Tripp talking to his students on Facebook yesterday was, he said one of the things, champions rise, and by that meaning we're all in this together. So I think that Las Vegas, San Miguel, and the surrounding agencies should be champions for our whole citizens, and that could be part of our logo, our slogan, like Matt had said, be one, and we're all champions at the end.
Yep.
So just a few things to say about that.
Thank you. And Adrian, the other person that's hit the ground running and I don't think has stopped since March is Mr. Maestas. And I could call him at any time, day, night, whatever, weekend, and he answers his phone. And we're just very blessed to have Leo Maestas in that position. I don't think anybody could have done a better job, Leo. And I know you hit the ground running and you're still running, and you've sacrificed a lot of time and your family and everything for your job and taking your job seriously. And I can definitely let you know that every time I've called, you've been there or you call me right back. And that speaks volume to the type of person that you are. And thank you so much, Leo, for everything. I just keep wanting to call you Jose, but it doesn't fit for some reason. Thank you so much, Leo. Appreciate it.
Mr. Mayor?
Yes.
On behalf of the Romero Law Firm, we would like to contribute $1,000 worth of gloves and masks to those who need it in the community.
Thank you. Well, that's wonderful. Thank you, Mr. Romero. I'm sure we'll take you up on your offer. Thank you. And maybe Leo could help us with the distribution of those masks and gloves. Well, I see people. Yes.
Go ahead.
Luella, go ahead, Luella.
Hi, this is Luella Reed from Malta Vista. And first of all, thank you, Mr. Mayor, for the proclamation designating 1120 healthcare worker. As you all know, we have had a little bit of a surge here at our hospital. I wanted to give you an update. Currently, as of today, we have 6 in-house COVID positive patients. We have no ICU bed capacity, few med-surg bed capacity, and we average about 4 to 5 PUIs per day. We have worked with Mr. Leo Maestas, and we are very grateful for the county management, Ms. Dominique, oh my God, what a rock star at the state, with Matt Probst and 100% community. It has been a challenge. It has been a challenge for the hospital. Beginning in March, we heard about the surge, we got prepared, we had PPE, we are ready for the fight, and we were kind of like waiting for the fight. Our fight starts now. And we have a lot of nurses, as you all know, our nurses are all local nurses. Sometimes when people think about the hospital, they think it's a big hospital. And the reality is, on our med-surg unit, we staff 2 nurses for the day and 2 nurses for the night, and the same for ICU, 2 in the day and 2 for the night. So if you think about it, Alta Vista is a 54-bed licensed hospital. Our capacity is 12 patients on med-surg and 4 patients in ICU. So our nurses are tired. We have PPE, we have everything available for them, but I think just the not knowing what's going to happen, it's been hard. It's been hard on us. So thank every nurse that you know. Thank all your healthcare workers. We are going at full speed. Matt, I see you shaking your head. One other thing, we did do a little bit of change to our testing at our hospital. We used to do COVID testing Monday through Friday, 10 to 11. Currently, we have 13 employees out waiting for their COVID results. So they're considered PUIs. So it's been taxing on our employees. So we have had to reduce our testing down to Mondays, Wednesdays, and Fridays for people who have a doctor's order and for our own employees. So it's been hard. We're keeping up. Anything we can do to uplift our nurses would be very much appreciated.
Thank you, Luella. And I'm so proud of Luella. I knew her when we were working together at El Centro. She was a budding RN then, and she's just stepped up, and she's a wonderful RN right now. And thank you so much. Of course, we've been friends for longer than that, but Matt Probst, thank you for everything. You're running too, and you told me you were working 120 hours a week. You get everybody involved, including your kids and your wife, on projects for the community. And thank you for your dedication to our community, Matt. You're one of those pillars in our community, and I couldn't thank you enough for everything that you do.
It's about us. It's we. Louis, I mean, if you guys only knew behind the scenes how spread thin we are.
Yeah.
But our strength is each other, and that's Luella, Dominique. We're on the phone or texting each other constantly. We force multiply our resources together. And so, yeah, the hardest thing for me, honestly, is not the fight. That's what I was made to do. That's what I was born to do. The hardest thing is a feeling like those that you're fighting for aren't behind you, that they don't support you. And so in this group right now, I know we have all that support, but when somebody starts hacking on the hospital and the hospital staff, or somebody starts hacking on the Department of Health, or somebody starts hacking on any of the providers in town or anybody else, I want to get in the wrestling. I want to get on the wrestling mat with them. So yeah. I won't do that, because we're not here to fight each other. We're here to fight together, shoulder to shoulder. It's all of us against disease and despair. And we are taking a beat down right now, and we're spread thin. I just want to thank you guys all so much for supporting us. And there's going to be a bright dawn coming, and we're going to be all there together. Winning is being there, all there together to see that day and enjoy each other and hug again and all of that. That's what winning looks like now. It's too late to say COVID's not going to get us 24 today. It's here, but we could still turn it around. We could save a lot of people and prevent a lot of death. So thank you guys so much for your leadership. I can't say enough.
Thank you. Thank you. Thank you again, Mr. Crispin, Mr. Lopez, Mr. Wagner, for joining us today. With all respect, I really appreciate law enforcement. Like I said, they've always been there when I've needed them, and I appreciate that. I'd also like to take a small time, just a couple of minutes, to recognize Phil over at the Optic. They've been really great and very cooperative in helping our community, and people still use that resource for information. So I'd just like to recognize Phil and all his group at the Optic. They're doing a wonderful job, and of course the radio stations. With that, gentlemen, ladies and gentlemen, I will accept a motion to adjourn.
So move, Mr. Mayor.
Thank you. Second?
Second.
All in favor?
Aye.
Meeting adjourned. Thank you so much, everybody.